of Shalyatantra to take over the session. Welcome, sir.
In the previous session, we were discussing about the ulcers in the mouth and certain of the varieties. Now, the next part is about certain of the systemic disorders which can present with the lesions in the mouth, which do not require an independent treatment. The primary lesion, well, this needs to be treated, and that itself would be enough for the management of the symptoms in the mouth. Now, a few of the examples. One of them would be lichen planus. Lichen planus is primarily a skin disorder, and the treatment will be on the same lines as that of the skin disorder. And patients of lichen planus also may have a oral lesion where they may have a flat surface, flat lesions over the mucosal surface with certain thick borders, erosions and borders at the area. And these do not require a specific treatment specific to the oral cavity lesions. All that what we need could be somewhat symptomatic relief, and a symptomatic relief of this can be done by mafioustic quata or triple quata gargling. Once you treat this primary lesion of the lichen planus as any of the skin disorder like Kushta roga or maybe the Kushta variety, depending upon the symptoms like Kaishara, Gukula, Aragavardhini and so on, that itself would be enough to manage the ulcers in the oral cavity. There is no need of any specific treatment to the lesions in the mouth. Similarly, lupus erythematosus. Also, lupus also can present with the oral lesions quite frequently. That again, there is no need of any specific treatment for oral lesions. And the oral lesions of the lupus are presented with the sclerosis, that the fibrosis around the area and flat areas with some slough. And it will be also quite painful. And all that you need is maybe a symptomatic relief for the pain with the mosaic quata or the triple quata. If the lupus erythematosus can be managed otherwise with the usual treatment like the Ksharavasti and so on, and if necessary the steroid supplement, that itself would be enough for the management of the oral lesions. Similarly, another of the condition where the oral lesions can present is a Pemphigus. Pemphigus is also a characteristically cutaneous lesion where you will have multiple eruptions, vesicular eruptions, and it will be quite painful. And oral also the lesions can occur. Oral lesions of the pemphigus would heal without any scar, whereas the lesions of lupus erythematosus may end up in a scar. And once the pemphigus is treated, the oral lesions also will heal, and it may be like steroids may be required in such conditions as such. That's about certain of the issues. Chicken pox, another of the condition where you may have the oral lesions. The oral lesions in case of in case of the pemphigus, the oral lesions such as vesicular eruptions which rupture and then produce a wide raw surface, and it will be quite painful. So symptomatic treatment for the pain may be required. Chickenpox will be presented with the discrete vesicular lesions which may not rupture and may not produce such a raw surface as in case of the pemphigus. That's the basic difference. And the lesions again, they do not require a specific treatment. That's about one of the things. Another of the systemic disorder which can present with the oral symptoms predominantly is Behçet's disease. Behçet's disease is a multisystemic lesion where you may have it's an autoimmune disorder, and it may have presentation with the multiple systems. Neurological symptoms like it may present with strokes or even many times seizures, or it could be even presented with the lesions in the eyes where there could be sclerosis and the ulcers over there. Psychological symptoms like depression could occur, and gastrointestinal tract symptoms like the ulcers in the mouth or in the oral cavity, abdominal pain, and various digestive symptoms could occur. It's a very genital area, there could be ulcers over the genital area too. Skin, there could be erythematous rashes, and in the extremities also there could be deep vein thrombosis. So it's a multi-systemic involvement disease which though rare, it can occur, and in these conditions too, mouth ulcers, characteristically widespread mouth ulcers are seen, which are deep and may have even bleeding from that area. That's the typical Behçet's disease as such. Behçet's disease I would consider as a Vishamadvara And the treatment would be Lakshmi Narayana Rasa Arogyavarjini Amritarishta Agni Chikitsa Ksharadasti. Very few patients are seen. I have treated some 2 or 3 of the basic disease patients till now, and the treatment of Lakshmi Narayana Rasa Arogyavarjini would be quite beneficial in such basic disease conditions. And the symptoms of the Vishamadhyara like Nidra Nasha, Brahma, Shwasa, Tandra, Suptangata, Ruchi, Aruchi, Trishna, Moho, Madas, Tambha, Daha, Shidam, Sudiveta, Pakti, Tirena Doshanam, Unmadha, Shabdanta, Rasana, Parusha, Krishna, Sandhi, Murthas, Jaha, Nirbhutne, Kalshe, Netre, Karno, Shabdurgan, Mido, Pralapa, Stotsa, Paka, Kujanam, Kernak, Chutihi, Svedmutra Purishanam, Valpashutirat, Sutihi. It's exactly the same which is depicted in this picture, the same multisystemic symptoms. So the symptoms of basic disease and the Vishamadhyara Lakshanas mentioned in Sushruta are almost same. Now there is another very atypical clinical symptom or relatively rare clinical symptom which where there is no specific disease. It's a burning mouth syndrome. Patients may have a continuous symptoms of burning, and that burning mouth syndrome also is one of the quite common disease. Exact etiology is not known, but often it is supposed to be due to either anxiety or it could be produced due to these allergy to the food. Or there is another theory that it could be produced due to deficiency like diabetes or nutritional deficiency. And usually nutrition deficiency symptoms, they may have they may not have symptoms in the daytime, waking time. They may tend to develop the symptoms more at night and when they are taking rest as such. So that's also called as type 1. Type 2 is where the patients may have continuous symptoms throughout the day and is usually asymptomatic at night, which is often associated with anxiety. Now, those anxiety patients, they can be treated with the Smith-Sagarasa Kamaluka. Those patients with the systemic disorder like diabetes mellitus, they need a specific treatment for the diabetes. And nutritional deficiency patients, usually I would prescribe Draksharishta in such patients along with the Kamadika, which is a usual clinical symptom. And it's a Pitta Talupaka. And of course, food allergy, when the patients may say that only a specific food would produce that burning symptom, the management is relatively easier if you avoid that. Now, these clinical symptoms are very much resembled to that of the Pitta Talushosha or Pitta Talupaka. Pitta Shosha, the clinical symptoms are same. Shosho Atyartam Diritajabi, Taluhu, Shwaso, Vata, Talushosha Sapitata, Pittam Kuriat Pakam, Atyarthuram, Talum Yanam, Talupakam Mudanti. Though there are no visible clinical signs. Now, in a typical burning mouth syndrome, there will be no visible clinical signs, but the patient would have quite troublesome symptoms like. Among them, those patients who have the symptoms at night and produced due to nutritional deficiency like diabetes, they are more common than the other two varieties from the clinical management point of view. And in the asymptomatic patients with the anxiety, the treatment is relatively easier in Sagara Kamaluga, whereas patients with the systemic involvement like diabetes and so on, the outcome is usually poorer. That's about certain of the common ulcers. The next is about the carcinomas, one of the troublesome clinical conditions. The identification of the tumors in the oral cavity is a very difficult job or challenging job because many of the ulcers which we have referred to, they may resemble the lesions of the oral cavity, malignant lesions of the oral cavity, quite as such, and hence they are quite important to make out like. One of the easiest means of differentiating that would be you palpate the ulcers. If you have a suspicion about a nature of the ulcer, palpate the ulcer. If a ulcer has a induration, then the chances of this being malignant is quite high. And the other features are a large ulcer, usually an ulcer which is more than 2 centimeters in diameter. Then again, it's a chance that it could be a malignant. If the ulcer has more slough and raised edges, as you see over here in this third picture, that's also a sign, maybe chances of having malignancy. If the ulcer has a raised surface, as you see in the fourth picture, so feature where there is an induration. As you palpate, you can feel the induration. And if the ulcer is wider than 2 centimeters, if the ulcer has raised edge, if the ulcer has raised floor, then these are considered to be the important leading clinical signs to suspect the malignancy. And that's exactly what Sushila has mentioned, Wagbhat has mentioned as a Raktaja Arbuda. Raktopasusто Rudhiram Savataha Shonita Prabhu Khartura Sadusham Chapra Kshine Rakte Arbudam Veta. The lesion which looks like the Kharjura acid. And the Kafa Arbuda also would be presenting the same. Antak Kapalamasik the Shav Bandu Kaparbudam Kuriatam Ghattitam Thinam Rutitam Chibivardhate. It tends to proliferate, and even after removal, it can produce the same lesions as such. Now, the types of the malignancy are either squamous cell carcinoma. More frequently in the oral cavity, they are the squamous cell carcinoma, and the others are adenocarcinoma, which also may occur quite occasionally. The squamous cell carcinoma are more common in the persons who chew tobacco or consume irritant substances, and many times it will be comparatively painless or relatively less painful. Pain will be felt only when the patient swallows, and it's characterized by either the erosion of the area, either erosion of the tongue or erosion of the mucosa, that significant erosion, and or a raised surface, as it's usually the squamous cell carcinoma. The oral squamous cell carcinoma, you have to examine these specific sites, the sites, quite frequent sites where the oral carcinoma, oral malignancy tend to occur, which need to be palpated. So, suppose if you have a suspicion, the areas which need to be palpated are, you have to palpate the base of the teeth, the gums have to, gingiva, which have to be palpated. The mucosal fold has to be palpated, lips have to be palpated, the buccal mucosa throat has to be palpated, the posterior surface angle of the mouth is also has to be palpated, and the mucosa of the lower lip and the vestibule of the oral cavity, this needs to be palpated. And you also have to have the palpate the hard palate as well as the soft palate. The tonsilary areas are the other areas which may be difficult to palpate, but that's the area where you have to examine for the oral lesions. So, and the ventral surface of the tongue also has to be either palpated. So that's whenever you are screening a patient for a suspected malignancy of the oral cavity, it's mandatory that you palpate all these areas specifically, and only when you do not find any abnormality, then you may say that the patient is free of the lesions. Or if you palpate carefully these areas, identification of the lesion at an early stage is possible. That's the important issue. Incidence of the oral carcinoma is increasing very rapidly, and particularly in males because of the habit of chewing tobacco and the tobacco products as such. Incidence is increasing very rapidly in the past few years, and by 2020 it has reached a very high level of, and this is about the data in India. The data in India where it's increasing. So it's one of the diseases which can be attributed to the lifestyle, and lifestyle suggestion is quite important. And among the globe, in the whole world, the maximum incidence of the oral cavity malignancy is in India. Now you look at this color of the oral globe, so that's one of the area where we need to be cautious about. Among the causes are the tobacco chewing and cigarette smoking. Both are very common causes as such, and the incidence is very frequent in India, and hence there is considered as one of the major health concerns related to our country. That's about one. Then the next is about the lesions which may produce a suspicion with the malignancy, confusion with the malignancy. They may not be malignant, or some may be even precancerous, and among them verruca vulgaris is one of that, or verrucous lesions, verrucous ulcers could be one of the lesions. It can produce a suspicion with the malignancy. So where the surface would be raised, there could be ulcers with the raised surface, and maybe at times it could be even looking like a fungating lesion. But characteristically there will be not much of an induration. Absence of the induration is characteristic in the varicose lesions, but it's better that whenever you have a suspicion, it's better to have a biopsy. Histopathological study is necessary. In all these conditions, whenever there is a suspicion, safer is to have the biopsy and confirm whether it is malignant or not. Similarly, non-genital warts. Warts also would be painless and relatively firm and absolutely no induration. Painless conditions which could be seen in the oral cavity also can produce some certain suspicion with the malignancy. That's about the few oral cavity lesions in brief. So, malignant lesions, particularly in brief, as such. Then, of course, as far as the treatment is concerned, in case of the oral malignancy, the primary responsibility is to identify the lesion. Then you think of the management, and there is virtually no curative medical management. All that management will be radiation or chemotherapy or so on. A palliative management with the Kanchan Aragukuru or Aragyavati may be prescribed only when all the other options are not acceptable to the patient. So that has to be very clear. So we will not consider our treatment as a primary treatment of choice in such conditions. It has to be only after the other options are ruled out. Now that's about one of the issues. Now another less harmful, or rather virtually not harmful at all, is the Fardis spots. Fardis spots are, again, the exact etiology is not known, and all that what you see is some areas of hyperkeratinization over the lips or maybe in the oral cavity, mucosa also. It's a painless. Only the thing is, it produces a keratinized area which produces a visibility, cosmetically not so acceptable issue. Often it is attributed to the cosmetics uses like the even lipsticks and so on, or at times it's also considered to be a genetic issue. The exact etiology is not known. It's absolutely painless, no other symptoms except the cosmetic visibility. There is no need of any specific curative treatment, but if at all the patient is worried about the cosmetic appearance, the treatment has to be a laser treatment, vaporizing laser treatment with the carbon dioxide lasers like frozen the carbon dioxide treatment as a cryotherapy is the only option there. It's only from the cosmetic point of view. Though it looks like odd, it's not a harmful condition. It's a very simple issue. Exact etiology is not known as such. But incidence of this also is increasing. These days, incidence is increasing. Maybe because the patients are more conscious about the cosmetic appearance. Earlier, patients might not have reported it to the same extent. Anyway, this kind of issues also are seen quite frequently clinically. So that's one of the issues. Then another of the condition which can produce some confusion would be the papillomas. Papillomas are the increased size of the papillae of the tongue. Again, the real causes are not known. It's considered to be simply a genetic factor, and it will be asymptomatic condition. Only thing is, when you look at the tongue, you may see these raised surfaces, which may produce a confusion with a tumor pathology. Characteristically, it's asymptomatic, and the patient would not have any even issues. Only when you see the tongue may look rough, and palpation will give you a soft feeling of the papillae. So it doesn't require any treatment. The only point of referring to this is because it's one of the conditions which can produce some confusion with the tumor pathology. And of course, if you still have a doubt, you may have a biopsy in such conditions even. No need of treatment. There is no question of treatment for papilloma. Now, another of the conditions related to the tongue as well as the system is the Plummer-Vinson syndrome, which is quite frequently seen in our clinical practice. It's an iron deficiency anemia, usually quite frequently seen in the middle-aged females, where the patient would have a deficiency anemia, and as a result of that, the patient also would have a accompanying symptoms of a baldness in the tongue. Tongue becomes bald, and at the oropharyngeal junction, you may see a fold-like structure, thickening or fold-like structure. Spasm of the oropharynx is the characteristic symptom. In such patients, along with the usual clinical symptoms of the anemia, patient also may have a difficulty for swallowing, particularly difficulty for swallowing liquids, not the solids. Solids can be swallowed better, Liquids, the patient may have a difficulty in swallowing. Now, that's a very typical symptom. In any other mechanical defects, any other lesions with mechanical injuries, patient would have a difficulty in swallowing solids than liquids. Whereas in spasmodic disorders, it's the liquids which make the patient more difficult, like the patient feels more difficulty in swallowing than the other way. And this is often considered as either a effect of anemia or many times a coexisting syndrome of the anemia, and that's why it's called as Plummer-Vinson syndrome. Incidence of this is quite common, and the treatment very characteristic is the bald tongue, the typical bald tongue where the papillae are almost absent. Smooth surfaced tongue is the characteristic appearance, and this is considered as either the upadrava of Pandu or the upadrava of Kshaya. That's exactly what's mentioned in the Samhitas. Upadrava in case of the Pandu is the Kantagataha Abalatvam, the Shofastata Kantagataha, the fold that fold of mucosal membrane seen at the throat is one of the upadrava of the Pandu. That Kantagata Shofa is the upadrava of the Pandu, and of course along with other symptoms. Or in case of the Kshaya, again you may have Kantha Udhvansam, Ururjam, Kantha Udhvansa. The destruction of the Kantha is another of the upadrava of the Kshaya. Now, this can be considered as either the Kshaya or the Pandu. And my treatment usually would be Chandraprabha, Punarnam, Daksharista. And once the anemia is corrected, the symptoms, Plummer-Vinson syndrome is reversible if it is treated quite early. But if the fold has become thicker and it has become now fibrous, then the symptom of swallowing difficulty may remain for a quite a long time, or it may not be cured completely, though the anemia gets corrected and other symptoms will be corrected as such. So that's another of the condition, incidence of which is now increasing somewhat, quite more frequently than the other. Then the other lesions of the oral cavity, which are not really primary oral lesions or primary gastrointestinal tract lesions, are one is the pellagra, which is supposed to be a deficiency conditions, and I think pellagra also is characterized by a bald tongue with the cracks over the area. Typically, a bald tongue with the cracks over the area. Along with that, the pellagra patients also may have cutaneous lesions like the superficial erosions of the keratin tissue and very superficial scaling, not typically ulcers. These are the typical features of pellagra, which is supposed to be deficiency, vitamin B deficiency condition. The characteristic clinical symptoms along with these tongue signs are appetite being poor, diarrhea, skin, neuropsychiatric symptoms. Many times the patient would have anxiety and so on. And that's exactly what we consider as a upajifika. जिह्वाग्रूपश्वैतुर्जिह्वाम् उन्नम्य जातः कफरक्तयोनिः प्रसेक कंडु परिदाहयुक्त प्रकथ्यते असौ upajihvika. Upajihvika where the tongue becomes bald and cracked surface, the tongue looks like an abnormal tongue. And the better treatment than in case instead of providing these vitamin supplements, Arogardini and Kumaria is a better treatment. Of course, the contemporary treatment will be providing vitamin supplements. Some of the patients may respond to the vitamin supplements, but we will have plenty of patients who do not respond to the vitamin supplements. And in such patients, Arogardini and Kumaria is a better option of the treatment, considering this as a consequence of the Agnimandya. Then another is the geographic tongue. It's again the causes are not known. Often it's supposed to be a immune mechanism, or at times it's related to the psoriasis conditions. And there are many drugs which are supposed to be, again question mark, like whether really the drugs are producing this geographic tongue or not. But characteristically, a geographic tongue would present with the scaling lesions, thick and thickening and irregular surfaces and discoloration lesions, which look like the map, geographic map, like you will have a clear border and it shows some islands of this thickening and hyperkeratinization, and then of course relatively thin areas, and characteristically there may not be pain but the patient may have a intolerance to the food. When the patient consumes the food, certain of the food, particularly irritant and hot food, it can produce the symptoms. And the tongue looks rough, very rough as such. Now that's I would consider this as the Bataja this Jifa or Prakopa or Jifa lesion, lesions of the tongue, Bataja tongue lesions. Jifa Anilena Sputita Prasutta Viveka Shakachadana Prakasha, Shakachadana like the leaves of the Shaka Vriksha. Now, that's exactly the clinical symptoms can to occur. Very often, geographic tongue pathology also could be a long-term consequence of the typhoid. Now, whether it's a consequence of the typhoid or whether it's a consequence of the treatment for the typhoid, medicines given for the typhoid. Again, there is a bit of controversy. Anyway, patients who have recovered from the typhoid, you may have patients presenting with the geographic tongue quite frequently, and this needs to be differentiated from other infective lesions. That's another of the oral lesions which we see, and in that condition, the treatment would be, of course, the patient has to be given a strict dietary advice to avoid all irritant substances, and the usually my prescription would be triple glucosamine, as we consider this as a variant of Urana, non-healing Urana. Then fissure tongue is another of the issue. Again, the exact causes are not known. The only thing is that when you look at the tongue will see, you will see some cracks over the tongue, and often it is attributed to the food, particularly certain varieties of the food. When the patient consumes, this tends to occur, and many times it could heal spontaneously. It may heal spontaneously. At times it could be chronic. So fissure tongue very often is a spontaneously healing condition. The exact causes again not known. Some of the patients have a higher tendency to develop the fissure tongue. Even anyone may develop that fissure tongue if you consume lots of spicy food. Excess of spicy food can produce that fissure tongue temporarily. And in that condition, virtually again, there is no need of any specific curative treatment. My advice is, one is the dietary advice, that's all the important issue. And then Thilathela Gandusha can help significantly to reduce the symptoms. Though it's spontaneously relieving, the relief can be earlier and maybe somewhat more efficient with the Thilathela Gandusha. Then the next is about the pigmentation disorders of the oral cavity. Now, patients who have present with the pigmentation in the oral cavity, dark pigmentation spots, is again quite difficult to make out. One of the advice is, if you find a pigmentary spot in the oral cavity, never avoid palpation. Palpate the oral area, see whether it is palpable or not. A non-palpable macule in the oral cavity comparatively is harmless, is a general rule. If at all there is a no palpable area, then you need to investigate. That's the general rule. Among those harmless conditions, the pigmentation disorders like melanotic macules, melanoma macules, they are harmless conditions. Of course, from our Sushruta point of view, Sushruta has identified these conditions where there could be discolorations of the oral cavity as the ecapedica, the Sanipathinipedica, particularly palpable. Non-palpable, of course, not specifically mentioned. And what Sushil has mentioned is Sakrat Krishna, Sakrat Pito, Sakrat Shweto Tathevata. The variations in the color could be Krishna, Pita, or the Shweta. And they need to be considered as a Sanipataka, and the treatment has to be according to oral cavity. Now, when the another of the issue is the intramural nevus is the birthmark, like matche, and that again it's generally not palpable. When as long as it is in the superficial area, in the intramucosal area or the junctional area, then it's non-palpable. It's superficial, and you will not have much of these palpable symptoms. The induration is not at present. When it is a compound, like where both the intramucosal as well as the junctional, the lesion is deeper, then it may become palpable, and there you need to go for the investigations. If it is still deeper, just below the brain level, often it may look blue. So a dark intramucosal nevus is suggestive of these, the first three, intramucosal, junctional, or compound. A blue is suggestive of a deep, which doesn't require any treatment. It only looks like a bluish spot. So these are birthmarks, actually birthmarks, but often they may produce a confusion. So from that point of view, you need to have some idea. Virtually, there is no need of treatment for these nevi, and this can only the important is you need to rule out the other possibilities of a tumor or so on. Then another of the pigmentation causes would be the amalgam induced. Those where they fill the teeth with the amalgam, that amalgam may reach out to the surrounding area and they may produce a pigmentation. This again is a common issue. Of course, with the present day situation where the porcelain material is used, this kind of incidence is lesser. But earlier days, when metallic amalgam was used, gold or other metallic amalgam was used for tooth filling, this incidence was common. So, from the present day's point of view, issue or incidence of these amalgam-induced pigmentations are less common because most of the times the dentists use porcelain material, and porcelain material doesn't produce this pigmentation, whereas metallic processes which are used or metallic chemicals which are used for filling the teeth, they used to have that pigmentation quite frequently. And of course, this doesn't require a specific treatment. Only thing is, it has to be identified and the cause has to be substantiated. So that's another of the condition where the patient may present with the pigmentation in the oral cavity. Then the malignant melanoma in the oral cavity is comparatively rare. Compared to elsewhere, a malignant melanoma in the oral cavity is very rare, and it is characterized by the induration, a blackish spot with the induration and enhancing. The size is enhancing. And it could be either in the lips area or in the vault of the mouth, angle of the mouth, that it could be seen. And this needs a specific treatment, and prognosis also is poor. So that's about one of the malignant lesions. Then another of the malignant issue, non-malignant, but the pigmentation issue is a Peutz jeghers syndrome. Now, in these cases, patients may have multiple spots of pigmentation in the oral cavity, non-indurated. They look like birthmarks. Often they look like birthmarks, nevi, and only thing is they will be widespread. So, in such conditions, and it's present both in the tongue as well as in the oral mucosa, buccal mucosa, it's a possibility that it could be Peutz syndrome. And the oral pigmentation there is harmless. That doesn't produce any symptoms. But such patients have a higher tendency to develop intestinal polyposis. Intestinal polyposis is a coexisting condition. And the general rule is, if the patient has a oral lesion, you need to investigate the intestines to see whether the patient has a polyposis. Many times patients with presenting with the symptoms of polyposis, symptoms of intestinal polyposis, this could be another mirroring same the asset. So Peutz jeghers syndrome is a syndrome of oral pigmentation with intestinal polyposis. And the real cause of concern would be the intestinal polyposis. Whether they require a surgical treatment or not, whether they can be managed medically or not, that's the other issue. But all intestinal polyposis are having a high risk of developing malignancy. The treatment would be a surgical or biopsy would be necessary because there is a possibility of malignancy. If at all there is no evidence of malignancy, I will consider these as sahaja. And very interestingly, Sushruta, when he has mentioned about the sahaja arshas, the symptoms he has mentioned would be Sahajani, Dushashulita Shukra Nimittani, Tesham Doshadeva Prasadhanam Kartavyam, Visheshas Etani, Durdarshadani, Parushani, Pamsuni, Darunani, Darunani, Antarmukhani, Taihi Upadutaha, Krushaha, Alpabuku, Sirasantadatrah, Alpapraja, Kshinaretaha, Kshamaswaraha, Krodhanaha, Alpagni Pranaha, Param Alasashta, Grana Shiro Akshinasa Shravana Rogi. Patients would have the lesions over the forehead areas, above neck, ENT disorders can be seen. And Satsam Andhra Puja Atopa, Hridayopadepa, Arochika Prabhasipidiyate. So the one of the coexisting symptoms of the intestinal polyposis, Sahaja are the same. Of course, the management for the polyposis, there is no curative medical management. All that management would be symptomatic to as a palliative, so that the symptoms are be reduced. And characteristic symptoms of the intestinal polyposis are the same: malabsorption. Patient would not have proper absorption, and the malabsorption symptoms tend to occur. So we try to treat with the line of granny, and usual main prescription would be Gandhakarsana and Alokeratini is the usual Gandhakarsana and the Beryl is the usual prescription in such conditions. But the other issue is quite important. Like every polyp has a high chance of becoming malignant. So screening for the malignancy and the investigations like colonoscopy and biopsy are a must. And the oral lesions are just a secondary issue which do not require a specific management. Now, from the clinical point of view, Peutz syndrome presenting with the other polyps and malignancies, risk of malignancy in the system also are high, and the incidence of malignancies in a patient with that oral pigmentation is another of the issue, though not very major issue. It's considered like the risk ratio of developing malignancy in these sites: esophagus, stomach, small bowel, colon, pancreas, lung, testis, so on. The incidence percentage would be high in case of the esophagus. Malignancy in the esophagus is another issue. So, whenever the patient presents with the symptoms of this oral cavity pigmentation along with the polyposis, the other issues, patient may have a primary malignancies, any of these areas, which may produce the symptoms on their own, or at times, very rarely, you may not have these symptoms from the primary area, it's only the oral cavity lesion. So, all that importance would be the oral cavity lesions could be a mirror for or a leading sign for searching for the malignancy, or at times they could be considered as one of the consequent symptoms of the malignancy. The oral lesions and oral symptoms do not require a specific treatment. All that treatment would be from the other point of view. That's about the one. Then another of the issues related to the oral cavity, which commonly come across, would be halitosis or foul smelling breath. Foul smelling breath, majority of the conditions, the cause is unhygienic conditions, and 80% of them are unhygienic conditions, and often it's supposed to be bacterial origin. And particularly, persons who have taken antibiotics for quite a frequent, repeatedly, they tend to develop this bacterial colonization in the oral cavity quite frequently. Unhygiene as well as the development of multi colonies of the bacteria is another issue. And patients who have consumed sulfur compounds, like volatile sulfur compounds, maybe sulfur drugs, like not the Gandhakarsana. So that's the important issue. Or certain of the patients may have this foul smelling breath due to the other causes which cannot be managed easily. Patients who have either hyposalivation. Hyposalivation could be either some genetic pathology where the salivary glands are not fully developed, or destruction of the salivary gland after the radiation. From the clinical point of view, post-radiation hyposalivation is a quite frequent issue. If the patients have undergone radiation therapy somewhere near the neck and the oral cavity area, they tend to develop the hyposalivation as such. Now, patients with upper respiratory infections, nasal discharges, also may have a foul smelling breath, so that needs to be ruled out. A patient presenting with the foul smelling breath, you have to rule out these issues. Patients with liver diseases also can have a foul smell breath. Then certain specific food like garlic, fish, and so on, that also can produce a foul smelling breath. So when it comes to the question of management, assessing these causes are important. In general, now the management would be, suppose a patient has a respiratory infection that needs to be treated. If the patient has a liver disease, that needs to be treated separately. So whatever I suggest as a general line of treatment is not valid in such cases. But after you have ruled out all that, and it's primarily considered to be this primarily considered to be a casual origin of halitosis, often due to this bacterial origin, particularly this 80%, where the unhygienic and bacterial origin could be the cause. Hygiene is maintained, and hygiene can be enhanced by Triphalacata gandusha as such. And my usual prescription would be Agni Tundi Hingvasakutuna, considering this as a Agni Mandya. Now, it's a variety of the ajirna, symptoms of the ajirna, sanipata, anekabhu, durgandha, srava pichilo, akasmat, lana, samshuna rujo, vishama pakino. The patient would have that durgandha srava, durgandha as such in the oral cavity as a case of the ajirna. Now, the last part is about a general this another very popular option, this popular notion that tongue is considered to be a diagnostic tool. So I am not an expert in it. I don't believe in it. But these days, this has become a fad. By looking at the tongue, you can identify the systemic disorders. This is one of the fashions and maybe a new sort of medical discipline. Whether it is true or whether it is a fad, I don't go into that argument. People say that this is there are people who say that this is a fake and fad, but somewhat this is gaining popularity. The identification or diagnosis by looking at the areas of the tongue, something like your Chinese medicine. I don't believe in it. I don't accept that. I don't consider this as a valid issue. But from the point of view of discussion referring to this issue, I'm just referring to that. The like the thesis or hypothesis of that would be every system of the body is represented over the tongue, and the zones of the representation would be something like this: intestine, kidney, liver, and the lungs as such, heart. These are the areas, and by looking at the abnormalities of these areas, the diagnosis can be made out. This is what the basic theory of this tongue diagnosis is concerned. Many people present this tongue diagnosis as one of the branches of Ayurveda. So, now these are all the areas of controversy. I'm not going into that controversy. I'm not presenting this to take a side about the controversy. I'm just presenting the fact which you have to know, because many times the patients, there could be a few patients who may ask you certain queries about this issue, and these are questionable. Now, in these again, there is a general again notion like the tongue diagnosis may be shown of this sort, like a sensitive colon, or maybe according to some of the Ayurvedic people, this also is known like chronic water disorder of the colon, toxins of the colon, they could be represented in the tongue area. These are all the issues which are seen, which are presented, and somehow becoming popular in the society. I am not able to give a definite opinion about that. My purpose is just to sensitize, so no more questions on that part. With this, we'll stop at the tongue lesions. The next part is about the esophagus disorders of the esophagus. I think we continue in the next session, disorders of the esophagus. If there are any questions, I'll try to answer and then wind up. Right, there are no questions. Right, so we'll close, we'll wind up today.